Today, we're going to pull back the curtain on a hidden connection, a silent process that's happening inside so many of us, linking together some of the biggest health challenges we face.
So, the source material for this whole explainer kicks off with a really powerful question, right? I mean, we're so quick to point the finger at things like cholesterol or sugar, and don't get me wrong, they're definitely part of the story. But what if there's something else, something deeper, a hidden enemy that ties it all together? Well, that's exactly what we're going to dig into.
And that brings us to what the source calls a silent health threat. This isn't about the stuff you normally notice when you're sick. We're talking about a quiet, constant state of emergency inside your body that can fly under the radar for years, all while paving the way for some really serious problems.
Now, to really get a handle on this threat, we have to talk about inflammation. But here's the key. It's not all bad. In fact, inflammation has two totally different personalities.
You know, at its heart, inflammation is actually a hero. It's your body's personal paramedic. You get a cut, get an infection, and boom, the immune system rushes right in to clean up the mess and start the healing process. It's an absolutely crucial protective response. We literally couldn't live without it.
And this really lays it all out. The two faces of inflammation. On one side, you've got acute inflammation. Think of it as the good guy. It's your body's emergency crew. It shows up fast, does its job, the redness, the swelling, and then it packs up and goes home. Mission accomplished. But then there's the other side, our main suspect, chronic inflammation, the silent enemy. This one's tricky. It hangs around with basically no symptoms you can see or feel, and instead of fixing things, it just slowly, quietly causes damage over the long haul.
Okay, so how does this silent enemy actually connect to things like our heart health and our metabolism? Let's follow the clues and see exactly how this all plays out.
First, let's just be clear on what we're talking about. Cardiometabolic risk isn't one single thing. It's more like a crew of related issues. You can think of them like a gang. On their own, they're trouble, but when they all get together, that's when the risk of serious problems really skyrockets. And the big secret is that chronic inflammation is the glue holding this whole gang together.
And here it is. This is a huge shift in how we think about medicine. For the longest time, we thought atherosclerosis, the hardening of the arteries, was just a simple plumbing issue. Too much fat clogging the pipes. But that idea is completely outdated. We now know, for a fact, it is a disease driven by chronic inflammation.
So how does this attack actually happen? Well, it's a four-step process. It starts when the super smooth inner lining of your blood vessels gets damaged. Your body, trying to help, sends in immune cells. But instead of fixing the problem, they get stuck and actually help build up plaque. And then comes the most dangerous part. All that ongoing inflammation makes the plaque unstable, so it's much more likely to break off, and that's what triggers a heart attack or a stroke. It's a full-on assault, and inflammation is leading the charge.
Now, let's flip over to the metabolism side of things, because it's not a one-way street. Inflammation and metabolic issues like insulin resistance, they're trapped in this vicious cycle. They just keep making each other worse.
So here's the first part of that cycle. When your body's chronically inflamed, it's flooded with these little chemical alarm bells called pro-inflammatory cytokines. These things basically create a ton of static, jamming the signal between insulin and your cells. Your cells can't properly hear the message to take in sugar from your blood. And what is that? That's insulin resistance, the absolute cornerstone of type 2 diabetes. And here's where the cycle comes full circle. That insulin resistance, that poor metabolic health, it leads to an increase in a very specific, nasty type of fat. And this fat isn't just storing energy. Oh no, it's like an active factory, constantly churning out more of those inflammatory alarm bells, which just pours gasoline on the fire. It's a system that fuels itself.
So what is this stuff? What is this metabolically active fat that's acting like the main accomplice here, constantly fanning the flames?
It's called visceral fat. And this is not the fat you can pinch on your stomach. This is the deep, hidden fat that's packed in and around your internal organs, your liver, your intestines. The most important thing to get here is that because of where it is and how active it is, it's a primary source of body-wide inflammation.
So what's this visceral fat actually doing? Well, it's busy. It's pumping out inflammatory chemicals. It's sending out signals to call even more immune cells to the area, which just makes everything worse. And it's messing with the hormones that are supposed to be keeping everything in balance. It's basically a non-stop pro-inflammatory engine running inside you.
Okay, so we've unmasked the silent enemy,
We've seen its playbook, and we know what's fueling it. And I know that might all sound a little grim, but here's the fantastic news. We can absolutely fight back. So let's talk about the plan. How do we put out these flames?
The source material lays out a super clear 4-part strategy. This isn't about some magic pill, it's about a holistic lifestyle approach. It starts with nutrition, what you eat. Then there's physical activity, which is huge for reducing that visceral fat and making your body more sensitive to insulin. Next is weight optimization, and the key word there is optimization. It's about focusing on that dangerous internal fat. And finally, you got to tackle stress and sleep. Both chronic stress and not getting enough sleep are like throwing fuel on the inflammatory fire.
And when we talk about nutrition, the game plan is actually pretty straightforward but so powerful. It's all about loading up your plate with anti-inflammatory heroes, things like fruits and veggies, fatty fish, nuts, and seeds. And, just as crucial, you want to limit the troublemakers, the highly processed foods, and all those refined sugars that are known to fuel inflammation.
I just think this quote from the source material says it all. The process itself might be quiet, maybe even undetectable for years, but the consequences, things like heart disease and diabetes, trust me, those are anything but silent.
And that leads us right here to the last and maybe the most important question of all. Now you know, you've seen the connection. So the question is, what are you going to do about it? What's one small step, one single thing you can do, starting today, to begin putting out those flames?